My name is Justin, and I'm going to be performing a physical assessment from head to toe on my friend Liz here. We'd start our assessment by introducing ourselves and washing our hands. So we wash our hands, and overall, now here's where we start physical assessment. And we're checking for just general appearance to see how the patient is dressed, if they're alert and oriented, and Liz appears to be alert and oriented times 3, no problems there. And she's appropriately dressed for the inclement weather, it being winter time, and she doesn't appear to be in any acute distress. You have any questions for me before we start this assessment?
No.
Okay, alright. And now we're going to move to the head, and we check the hair distribution. The hair seems to be okay. She's not thinning. And then you want to palpate for any lumps, bumps, or bruises, and I don't feel anything. And then from the head, you want to go to the ears. And we're going to go to the ears. We just do a physical assessment of her ears, and they appear to be okay. There's no lumps, bumps, or bruises noted upon palpation. And if we had an otoscope, this is where we'd look at the tympanic membrane, and the tympanic membrane should appear to be a bluish gray color, which is normal. And you can visual the canal here and see if there's any earwax. She has no earwax or any discharge noted. Next we'll check the eyes. And with the eyes, we'll kind of do a combination of checking the pupils. We'll look at those, and we'll look at the overall appearance of the eye and see if there's discharge or anything. So we'll look at the eyes. Okay, her scleras are a nice white. There's no conjunctivitis noted. There's no redness or irritation noted at her eyes. Her eyebrows and eyelashes appear to be normal. Let's see. Yeah, her eyes appear to be normal. And next we move to the nose. We're going to look check her nose for nasal patency, and by that you touch the bridge of the nose and you palpate and you feel if there's any deviated septums. You can look at that if there's an obviously deviated septum. Next you'll have your patient tip their head back. You'll check for nasal patency, and her nares appear to be patent. There's no nasal flaring. There's no discharge noted. And next we'll check her mouth. I'll have you open your mouth. Okay. And here you're checking for dentition. She has very good dentition. Her tongue appears to be nice pink. There's no white patches noted. There is no redness noted. Her palate appears to be intact, and it's nice pink. Okay. We check the head, the eyes, the ears, the nose, and the throat, and you want to check their trachea to make sure it's midline. And her trachea is midline. You'd be able to tell if there's an obviously abnormality with the trachea being deviated one way or the other. And they also probably would have some respiratory distress. Okay, next we're going to check sinuses. And we check the sinuses by the frontal sinuses by palpating up here, and any pain or tenderness with palpating. Any pain?
Oh, I'm sorry, no.
Oh, okay. And then you check the maxillary sinuses here above the cheeks, and any pain or
no.
Okay. And back here behind the ears is the occipital tonsillar sinus, and any pain?
No.
Okay. And oh, I also forgot the TMJ, the temporal mandibular joint. And by checking this, you have right here, you have the patient open their mouth, close your, okay, and you're checking for a click or hearing for a click, and I didn't feel or hear a click at all. Next, we want to check, let's see, the TMJ lymph nodes. Okay, we'll check. We check the lymph nodes, the pre-occipital, the post-orbital, and you're going to check those. Sorry, I'm a little out of order. You just palpate here, and I don't feel any abnormalities or problems. Oh, And you want to check the sternal masculoid lymph nodes. You have your patient shrug their shoulders, and then you just kind of palpate here, and I don't feel any abnormalities noted with the nodes there. And let's see, head shrug shoulders. Oh, carotid arteries. We want to check the carotid arteries, and you will just palpate the artery, and you should feel a nice bounding pulse. And you never want to check them both at the same time, as you can cause your patient to pass out. Next, we will move to the cranial nerves, and there's 3 branches of the cranial nerves. This number 3 cranial nerve checks the head, neck, and chin. The trigeminal nerve, and we do that by using a, well, if I can find it here, object, and I will do this by touching 3 different spots, and I'll have the patient describe what I'm doing. Where am I touching you?
Forehead, and it's soft.
Okay.
Cheek, and it's soft. Chin, and it's soft.
Okay. And that is the trigeminal nerves, the 3 different areas checking for the head, cheek, and chin. That's the 3 branches of the trigeminal nerve. Next, we'll check the facial nerve number 7, and we'll have the patient do this by closing their eyes, and then you try to open them, and I'm not able to, so that cranial nerve, and that's how you check for that. And there's also a second part of it. You'll have the patient puff their cheeks out, and then you try to, okay, and I am unable to push her cheeks in as she puffs them out, and that is checks also. And can you smile for me? Okay, good. And so cranial number 7 seems to be intact. Now we will check for cranial nerve 3, 4, and 6, and this is check for the nystagmus of the eye. And by doing this, we have the patient follow your finger. And you want to do this slow, so you can check to see if there's, with the eye, if their eye twitches when you move side to side. So, and her eyes, that cranial nerve seems to be intact. I see no problems noted with that. Next is the corneal reflex, and we check that by touching the side of their eye, and the patient should blink, and she blinks, so that the corneal reflex is intact. Next, we want to check perla of the eyes, which is the pupils. Okay, look at me. Okay, good. Pupils are equal active. They're round, and they reacted to the light. Her pupils started out at about a 3, they went down to a 1, and now they're going back to, they're about a 2, almost 3 now. And next we want to check accommodation. By checking accommodation, we have the patient stare at that sock hanging up on the wall. Okay, and we check their eyes, and you look, you bring from focus, from a distance to an object close. The eye should accommodate that, and her pupils reacted to that. And so we did have the accommodating. So her eyes appear to be perla, pupils equal, active, round, reactive, and accommodating to light. All right. We will stop our video here, and we will continue as almost out of time.